So today's lecture is the cerebrum. Remember when we were talking about the development of the nervous system, we talked about two components of the nervous system. We talked about the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain. This is the brain and the spinal cord. The brain and the spinal cord form the central nervous system, and they arise from the neural tube. And we say that the cephalic end of the neural tube forms three directions: the prosencephalon, the mesencephalon, and the diencephalon, and the rhombencephalon. The three vesicles in the cephalic region of the neural tube are the prosencephalon, the mesencephalon, and the rhombencephalon. Prosencephalon, the forebrain; mesencephalon, the midbrain; rhombencephalon, the hindbrain. And those are the vesicles which form the brain. The rest of the tube remains and it will form the spinal cord. So that is how the neural tube develops into the central nervous system. The peripheral nervous system, made up of the components of the cranial nerves, spinal nerves, and autonomic nervous system. That's the peripheral nervous system. We say that the peripheral nervous system develops from the neural crest cells, which separate from the neural folds before they fuse to form the neural tube. You remember that very well. So those neural crest cells are the ones which give rise to the peripheral nervous system. And the remainder of the tube gives rise to the central nervous system, which is made up of the brain, developing from the three brain vesicles in the cephalic region of the tube, and the spinal cord, which is the remainder of the tube in the caudal region. Those are the primary brain vesicles between week 3 and week 4. Then in week 5, the primary brain vesicles form the secondary brain vesicles, whereby the prosencephalon, which is the forebrain vesicle, divides into the telencephalon and the diencephalon. The mesencephalon increases in size because of differential growth, and the rhombencephalon, which is the hindbrain vesicle, divides into the metencephalon and meidencephalon. And we saw the spinal cord continuing to grow from the rest of the tube and becoming shorter by the time. So today we are looking at the cerebrum. From which brain vesicle does the cerebrum develop from? I need an answer. From which brain vesicle does the cerebrum develop from?
The telencephalon.
The telencephalon, is it a secondary vesicle or a primary vesicle?
It is a secondary that comes from the prosencephalon.
Good. So today we are going to look at the cerebrum, which is derived from the telencephalon, that secondary brain vesicle. And the telencephalon is further in turn derived from the prosencephalon. And prosencephalon is the forebrain vesicle, meaning that the cerebrum is part of the forebrain. So whenever you look at a brain, there is this part which has folds. This folded part of the brain. Some people think that it's the only part of the brain. No, it is not the only part of the brain. So this folded part of the brain is known as the cerebrum. This folded part of the brain is known as the cerebrum. And that is what we are going to look at. This is the cerebrum, the folded part of the brain. All sensory information must first reach the cerebrum so that you become aware of it. Any sensory information which does not reach the cerebrum, you will not be aware of it. That is why the cerebrum is known as consciousness, because you become conscious of sensory stimuli. Sensory stimuli from the skin must ascend up to the cerebrum, and when they reach the cerebrum, you become conscious of them, meaning that they have reached consciousness. When they say that information has reached consciousness, they are trying to tell you that it has reached the cerebrum. And they use the word consciousness because whichever information reaches the cerebrum, you become aware of it, or you become conscious of it. There is information which moves up to the brain, but because it does not reach the cerebrum, you're not going to become aware of it because it has not reached consciousness. But it's also important. There is a lot of sensory information going on in your body, ascending to the brain, but you're not aware of it. But it is very important for the normal functioning of the brain and the body. But the information which reaches the cerebrum is the one which you become conscious of, which you become aware of, because the cerebrum is going to interpret it and make meaning out of it. This is the cerebrum, the folded part of the brain, which has these folds, and in between the folds, you can see there are depressions. The folds are known as the gyri. Gyri is plural. Gyrus is singular. So one fold is known as a gyrus. Two or more folds are known as gyri. The depressions in between them are known as sulci for plural. Singular is known as the sulcus. And this is the cerebrum, the folded part of the brain, which is made up of the folds known as the gyri and the depressions between them known as the sulci. It is known as consciousness because all information ascending and reaching the cerebrum is interpreted and you become conscious of it. You become aware of it. Why is the cerebrum folded? It is folded to fit within the cranial cavity. It is folded to fit within the cranial cavity. And it is only part of the brain. It's only, there are other parts. It's just a part of the brain. This is not the entire brain. Now, the brain is made up of two cerebral hemispheres, a cerebrum on the left and a cerebrum on the right. A cerebrum on the left, known as the left cerebral hemisphere, and a cerebrum on the right, known as the right cerebral hemisphere. And the two cerebral hemispheres are divided by a depression known as the median longitudinal sulcus, known as the median longitudinal sulcus. Someone tell me, how are they, which view is this? Is it lateral view, anterior view, posterior view, or superior view of the cerebrum?
Superior view.
So when you look at the brain from above, someone is sitting and then you go above them and open their skull and look at the brain from above, you're going to see two cerebral hemispheres, a cerebral hemisphere on the left and a cerebral hemisphere on the right, separated by a depression known as the median longitudinal sulcus. Another point, the two cerebral hemispheres are connected with each other. They are interconnected. Neuron axons connect these two hemispheres. When you open this median longitudinal sulcus, when you separate the two hemispheres, and go deep into the median longitudinal sulcus, you're going to see nerve bundles coming from the left to the right, connecting the two hemispheres. So this is what we mean. We have removed part of the hemisphere to dig deep into it. We have dug deep into the median longitudinal sulcus to see how the two hemispheres are connected. The two hemispheres are connected by these neuron axons. And this structure, which connects the two hemispheres by neuron axons, is what we call the corpus callosum. It is the structure connecting the two hemispheres. Neuron axons are crossing from the left to the right and from the right to the left. And when axons cross from one hemisphere to another, we call them commissural fibers. A commissural fiber is a nerve axon, a neuron axon, crossing from one hemisphere to another. So this corpus callosum is made up of neuron axons coming from the left hemisphere to the right and from the right to the left. And those neuron axons are known as commissural fibers because they are moving from one hemisphere to another. And they are located within this structure known as the corpus callosum, which is connecting the two hemispheres, so that the two parts of your body work in coordination. I first talked about the cerebrum and the brain vesicle from which it is located. And I also say that it's the level of consciousness, because you only become aware of sensory information if it reaches the cerebrum. And we said it's made up of folds known as the gyri and depressions known as the sulci. And I say that there is information which does not reach the cerebrum, but it is important. You're not aware of it, but it is very important in the functioning of the brain. We say that it has not reached consciousness. It is subconscious. Information that does not reach the cerebrum, we call it is subconscious. You're not aware of it. Information which reaches the cerebrum, you become aware of it or conscious of it. We call it conscious information. So when someone cuts you, you sense the pain. It means that that sensory information has reached the cerebrum. That is why you're sensing it. But if it is not reaching the brain, or which even if it is not reaching the cerebrum, you will not be aware of it. That's why they call the cerebrum consciousness. Then I say the cerebrum is divided into two hemispheres, the left and the right, divided by a median longitudinal sulcus. And the two hemispheres are connected by commissural fibers located in the structure known as the corpus callosum. And I say that commissural fibers are fibers which move. Fibers are axons, are fibers which move from one hemisphere to another. That is the corpus callosum. It is deep. When you open the median longitudinal sulcus and you look inside of it, you will see the corpus callosum, which is made up of commissural fibers. I can make a section of this brain, and that section is going to pass through the median longitudinal sulcus. So if I make a section through the median longitudinal sulcus, that section will separate the two hemispheres, and I will be able to see the medial aspect of each hemisphere. When I make a section through the median longitudinal sulcus like that, I'm going to separate the two hemispheres, and I'm going to look on the medial aspect of the hemispheres, because this is the lateral aspect of the hemisphere, cerebral hemisphere, and the medial aspect is there. So I can separate these hemispheres by making a section through the median longitudinal sulcus. So if I make a section through the median longitudinal sulcus, which section is that? Is it coronal, is it transverse, or is it sagittal? A section passing through the median longitudinal sulcus, is it coronal, is it transverse, or is it sagittal? a section passing through the median longitudinal sulcus separating the two hemispheres? Is it coronal? Is it transverse? Is it sagittal?
Sagittal, if it is from anterior to posterior.
It doesn't matter as long as it is dividing the brain into a left and a right side. It is sagittal. So I separate the two hemispheres. Then I am able to look on the medial aspect of the hemisphere. I am able to look on the medial aspect of the hemisphere. When I make a sagittal section, MRI and CT are going to make those sections sagittal, and you must be able to identify them. Let us look at an example of a sagittal section. That is a sagittal section. This is the medial aspect of one hemisphere, and the other hemisphere which has been separated, you can also visualize the medial aspect. So when I make a sagittal section passing through the median longitudinal sulcus, we call that a median sagittal section. And in the median sagittal section, I am able to look at the medial aspect of the hemisphere. And when I look at the medial aspect of the hemisphere, this is our cerebrum on the medial aspect. This is how the medial aspect of the cerebral hemisphere looks like. And because we have also cut through the corpus callosum, this structure, you also cut through it in sagittal, the corpus callosum. So you're going to see the cerebrum above it, and then below you're going to see the corpus callosum, because I have also cut through it in sagittal. So you're going to see our corpus callosum there. This is the corpus callosum in sagittal. This is the corpus callosum in sagittal. Let us look at the corpus callosum. I don't know whether we can have it here. Let me check.
Corpus callosum coronal.
So that is the coronal section of the cerebral hemispheres. This is a hemisphere, and that is another hemisphere. And what is this?
Median longitudinal sulcus.
Median longitudinal sulcus. And deep to it, what is this?
Corpus callosum.
And this is how the corpus callosum looks like in coronal section. This is how it looks like in sagittal section. This is how it looks like in coronal section, connecting the two hemispheres. So when I cut through it in coronal section, I'm going to see its entire extent connecting the two hemispheres. And that is how it's going to look like if I cut through it in coronal section. So I can make sections of the brain or the cerebrum in transverse, in coronal, and in sagittal. Those are the most common planes of the brain that are sectioned. And once you section the brain, you are able to look on the inside. There are structures you can clearly see in the brain section or in the section of the cerebrum in transverse. And the coronal section brings out some parts of the brain clearly, and the sagittal section also brings out some parts. So you must look at the brain using these three planes, because each plane shows you certain structures better than the other. Are we together?
Yes, sir.
Are we together? So this is how our corpus callosum looks like in coronal section, connecting the two cerebral hemispheres. This is how it looks like in sagittal section. This is how it looks like in sagittal section. And we are going to get a transverse image and we look at it in transverse. This is how it looks like in sagittal section. And I want you to observe, when I make a transverse section through the corpus callosum, the transverse section is going to go through the posterior part of the corpus callosum and the anterior part of the corpus callosum. Because it is a transverse section, it's going to go through the anterior part of the corpus callosum and the posterior part of the corpus callosum. In transverse, so this is the transverse section. You go through the anterior part of the corpus callosum and the posterior part of the corpus callosum in transverse section. This is the cerebral hemisphere on the left. This is the cerebral hemisphere on the right. This is the median longitudinal sulcus, and this is the anterior part of the corpus callosum. This is the posterior part of the corpus callosum. This is transverse section. In coronal section, this is how our corpus callosum is going to look like. And this is the median longitudinal sulcus. And these are the two cerebral hemispheres. And in sagittal section, median sagittal, this is how our corpus callosum is going to look like. And this is the cerebrum or cerebral hemisphere. I have talked about the cerebrum, and the point I've been stressing is that the cerebrum is made up of two hemispheres divided by the median longitudinal sulcus. And I said that the corpus callosum is that structure deep to the cerebral hemispheres containing commissural fibers connecting the two cerebral hemispheres. And I have also indicated to you how it looks like in sagittal section, how it looks like in coronal section, and how it looks like in transverse section. Remember, our topic today is the cerebrum, derived from the telencephalon, and the telencephalon derived from the prosencephalon, which is the forebrain vessel. And it is the largest part. The cerebrum is the largest part of the brain, as you can see. A few points to note here. I've talked about most people think that the cerebrum is the brain. No, the cerebrum is part of the brain, much as it is the largest. It is heavier in males than in females. However, this is not related to intelligence. It is just the differences in different body masses. These are intersexual differences. It is heavier in men than in females. The folds are known as the gyri. This is plural, or gyrus. I say that these are the folds. These folds are known as the gyri. And the depressions in between are known as the sulci, plural, singular, sulcus. The cerebrum, both on the right hemisphere and left hemisphere, is divided into lobes. The cerebrum is divided into lobes. The lobes of the cerebrum take up the name of the skull bone covering it. A lobe takes up the name of the skull bone covering it. So the lobe of the cerebrum, which is lying deep to the frontal bone of the skull, is known as the frontal lobe. The one lying deep to the parietal bone of the skull is known as the parietal lobe. The one lying deep to the occipital bone of the skull is known as the occipital lobe. And the one lying deep to the temporal bone of the skull is known as the temporal lobe of the cerebrum, both on the right and on the left. These lobes are both on the right and on the left. However, there is another lobe hidden deep to the temporal lobe. There is another lobe hidden deep to the temporal lobe, and that is the one we call the insular lobe. The frontal lobe, the parietal lobe, the occipital lobe, the temporal lobe, and deep to the temporal lobe we have the insular lobe. Written here are just summaries of their functions, but we shall look at the details of their functions. The frontal lobe, these are its functions. Motor control, motor function. The motor impulses which control your muscles to contract come from the frontal lobe. Motivation, aggression, sense of smell, mood changes, all these are functions of the frontal lobe. The one which is mostly talked about is the voluntary movement function. The parietal lobe, very important for interpreting sensory impulses. Sensory impulses, when they go to the parietal lobe of the cerebrum, they are interpreted. That's why they call it the sensory lobe. The occipital lobe, very important for vision. Your eyes collect light rays and they transmit them to the occipital lobe, and then the occipital lobe interprets them. The occipital lobe of the cerebrum interprets those light rays, and then you are able to see. It's the visual cortex. The temporal lobe is very important in the interpretation of smell and hearing stimuli, so that you can hear. And the insular lobe, we shall see its function, especially in motor coordination. So the cerebral hemispheres are divided in two lobes depending on the bone of the skull covering that part of the cerebral hemisphere, with the exception of the insular lobe, which is hidden deep to the temporal lobe. And these lobes are both in the left and the right hemispheres. So this is the frontal lobe, is anterior. This is the parietal lobe, which is covered by the parietal bone. Posteriorly, we have the occipital lobe, and laterally we have the temporal lobe, and the temporal lobe is the one which is covered by the temporal bone. Deep to this lobe, there is another lobe known as the insular lobe, which is not indicated here. And remember, we are looking at the cerebrum. Remember, the brain has parts like the cerebellum, the pons, the medulla oblongata, and the midbrain, but we are concentrating on the cerebrum. The frontal lobe is anterior and the occipital lobe is posterior. Below the occipital lobe, that is where our cerebellum is located. This cerebellum is part of the hindbrain, and we shall have a lecture on the cerebellum, but today we are concentrating on the cerebrum. What are the boundaries between these lobes? What are the boundaries between these lobes? These lobes are separated by the sulci. For example, this sulcus is known as the central sulcus. This sulcus is known as the central sulcus. It is the boundary between the frontal lobe and the parietal lobe. This sulcus is known as the lateral sulcus. The lateral sulcus separates the temporal lobe from these two lobes. The parietal frontal lobes are separated from the temporal lobe by a lateral sulcus. What sulcus separates the occipital lobe from the parietal and temporal? What sulcus separates the occipital lobe from the parietal and temporal? The sulcus which separates the occipital lobe from the parietal and temporal, you cannot see it laterally. You have to move on the medial aspect of the hemisphere, and This is the medial aspect of the hemisphere, and you look at this sulcus. This is what we call the Parieto-occipital sulcus. It separates the occipital lobe from the parietal lobe anteriorly. This is the Parieto-occipital sulcus. You cannot see it laterally. You have to turn to the medial aspect of the hemisphere, and you see our Parieto-occipital sulcus separating the occipital lobe from the parietal lobe. Frontal lobe, central sulcus, parietal lobe, Parieto-occipital sulcus, then occipital lobe. Temporal lobe, lateral sulcus, these two are separated from the temporal lobe by that sulcus. Those are the boundaries of the lobes of the cerebrum. Remember, the medial aspect is going to show us the Parieto-occipital sulcus, which you cannot visualize on the lateral aspect. Whereas the central sulcus, you can visualize it both on the lateral aspect and then on the medial aspect. The lateral sulcus can only be visualized on the lateral aspect. You cannot visualize it on the medial aspect. And this is our medial view. The frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe is only visualized laterally. There is this gyrus above the corpus callosum. The gyrus above the corpus callosum, part of it is in the frontal lobe and part of it is in the parietal lobe. Part of it is in the frontal lobe and part of it is in the parietal lobe. So this gyrus above the corpus callosum is what we call the cingulate gyrus, and it is part of the limbic system. But this is the part of the cerebrum which is a component of the limbic system, the cingulate gyrus, which is above the corpus callosum. Part of it is in the frontal lobe and part of it is in the parietal lobe. Remember, the different views show us structures which we would not have seen in the other view. So that is why you have to make different planes: sagittal, coronal, transverse, lateral view, medial view, superior view, inferior view of the brain, so that you see the different structures which cannot be seen properly. What are we seeing here? Who can tell me?
The insular lobe.
I say that deep to the temporal lobe, there is another lobe known as the insular lobe. You can only visualize it when you open the temporal lobe from the lateral sulcus. Then you see that lobe hidden deep to the temporal lobe, known as the insular lobe. That's an MRI image. Can't you locate the lobes of the cerebrum?
Yes, sir.
Is that a lateral view or a medial view? Is that a lateral view or a medial view?
It's a medial view.
It's a medial view.
You see where they are putting our central sulcus? This is an anatomical image, but the frontal lobe is bigger than you think. So the central sulcus is here from the medial view. So all this is the frontal lobe, and that is our central sulcus. Then this is the parietal lobe, and that is our parieto-occipital sulcus. And this is our corpus callosum. Which gyrus is this? Above the corpus callosum?
It is the cingulate gyrus.
Cingulate gyrus. Most of it lies in the frontal lobe and a small part of it in the parietal lobe. In fact, some texts consider that it is entirely in the frontal lobe. But what you need to know is that it is the gyrus above the corpus callosum, visualized in the median sagittal plane of the brain, and it is above the corpus callosum, it's part of the limbic system. Focus on the cerebrum. Which view is that?
It's the coronal view.
Which structure is this?
The corpus callosum.
Which structure is this?
The longitudinal sulcus.
Medial longitudinal sulcus.
Median. Which lobe is lateral here?
Temporal lobe.
The temporal lobe. Temporal lobe is on both sides.
And this can either be frontal or parietal, because you don't know where. If you make a coronal here, it will be frontal. If you make a coronal here, it will be parietal. Another point to observe. Which color, when you look at the cerebral hemisphere, on the inside, which color are they?
White.
Which color are they on the inside?
They look white. Gray.
Look at this. Which color is that?
White.
This is white.
Yeah.
And on the outside, they have a linear margin. Which color is that?
Gray.
Gray. So when you look at the inner aspect of the cerebrum, it has a gray cortex, and a white medulla. The cerebrum is made up of the gray cortex, and that is known as the cerebral cortex, and a white inner core or white matter on the inside, known as the cerebral medulla. Cerebral cortex, the outlining, which is gray matter, and the cerebral medulla, which is white matter. Cerebral cortex, which is gray matter, and the cerebral medulla, which is white matter. Why do we have white matter? The region where you see white matter, it means that in that region we have axons. What surrounds the axons? Who knows?
Myelin sheath.
A myelin sheath. And on top of a myelin sheath, there are glycoproteins. So the characteristic color of proteins is white. So that is why the region where you have axons, you have white matter. And that white matter is formed by the myelin sheath. So this region is white because there you have axons, and because axons have a myelin sheath and myelin sheath has proteins, that's why it looks white. And the cell bodies of the neurons are in the gray matter. The gray matter does not have a myelin sheath, that's why it looks darker. So in the cerebral cortex, which is gray matter, you have the cell bodies of neurons, and then in the cerebral medulla, which is white matter, you have the axons covered by a myelin sheath, and that myelin sheath is the one which produces that characteristic white appearance. So when you look on the inner structure of the cerebrum, you have a white matter and a gray matter. The gray matter is on the outside, it's known as the cerebral cortex, and the white matter is on the inside, it's known as the cerebral medulla. Where you have white matter, you have axons covered by a myelin sheath, and where you have gray matter, you have a concentration of cell bodies of the neurons. Those of you who have forgotten cells and tissues, you go back and look at the structure of the neuron. It is made up of cell bodies and then axons. Where the axons are white matter because of the myelin sheath, where the cell bodies are gray matter. We are moving a step at a time, and I'm only focusing on the cerebrum. Do not focus on other parts at the moment. The cerebrum has two hemispheres, as we have said, separated by the median longitudinal sulcus, connected by the corpus callosum. What did we call the cavities of the telencephalon? Because the cerebrum comes from the telencephalon. So the cavities of the telencephalon, what did we call them?
Lateral ventricles.
Are you seeing the lateral ventricles? This is the lateral ventricle in this hemisphere, and that is the lateral ventricle in that hemisphere. Let me go back to the coronal view, and I also show you those lateral ventricles. The lateral ventricles are very good, or they are very clear when you visualize them in the coronal view. Let's visualize them in coronal section and we see. This is our coronal section. Are you seeing it? We have told you, we have even shown you how it is made. For me, when I'm teaching, I use images, not notes. Notes I use, and I leave them for you to read. Have you seen the coronal image, how it's made?
Yes, sir.
And you're seeing the two hemispheres? And are you seeing these two cavities? These are the lateral ventricles. Those are the lateral ventricles, and that is how they look like in the coronal section of the brain. And some of you who remember our embryology last time very well, the lateral ventricles connect to the which ventricle? This is the third ventricle. This is a thalamus, and this is a thalamus. These two are the thalami which are derived from the diencephalon. So the cavity of the diencephalon, and the diencephalon, one of the largest structure which is derived from the diencephalon is the thalamus. A thalamus on the right and a thalamus on the left. And in between them, the cavity is the third ventricle. These two constitute what we call the diencephalon, and the cavity of the diencephalon is the third ventricle. So between the two thalami, which are parts of the diencephalon, their cavity is the third ventricle. And the two cerebral hemispheres, which are derived from the telencephalon, their cavities are the lateral ventricles. And we are seeing the lateral ventricles connecting to the third ventricle. And this is how they look like in coronal section. So let us look at the lateral ventricles and how they look like in a transverse section. Coronal, is it transverse? Is it sagittal?
It is transverse.
It is transverse.
Corpus
transverse
callosum,
section.
corpus callosum. Are you seeing this cavity and this cavity? In the hemispheres, part of it is anterior and part of the cavity is posterior. These are lateral ventricles. This is the lateral ventricle. That's the lateral ventricle. This is the posterior aspect. This is another lateral ventricle. So the lateral ventricles are very large. Parts of them are anterior and parts of them are posterior. That is in the transverse. In the coronal, you don't see the different parts, but in the transverse, you see the anterior aspect of the lateral ventricle and the posterior aspect of the lateral ventricle. These are lateral ventricles. They have an anterior portion and a posterior portion. In the middle here, you have the third ventricle, because this is the thalamus and this is the thalamus, and in the middle you have the lateral ventricle, a third ventricle. So these lateral ventricles from the hemispheres are connecting with the third ventricle, which is between the two thalami. In coronal view, you only see a section of the lateral ventricles. You only see a section of the lateral ventricles connecting to the third. But in transverse view, you see both the anterior portion of the lateral ventricles and then the posterior portions. All these are lateral ventricles. This is the anterior portion. This is the posterior portion of the lateral ventricle. So the lateral ventricles are bigger, but the coronal section only gives you a piece, but the transverse section gives you the entire picture. And in the middle here, we have our third ventricle. So they are communicating with the third ventricle. These are the lateral ventricles, anterior portions, posterior portions. And you can see this in transverse view. And in our transverse view, you can also see the inner white matter and the outer cortex, which is the gray matter, much as we have painted it brown, but it is gray. So that is the white matter and that is the gray matter. The cell bodies are here, the axons are in the white matter. Are you seeing the image?
Yes, sir.
Yes.
So I have talked about the gray matter, which is the cortex, and the white matter, which is the medulla, using the images. You go back and read the notes to make it clearer. The brain is lined by tissue. Now, I want you to look at this image. We are going to make this section of the brain, taking a piece of the right hemisphere, a piece of the left hemisphere, and a piece of the median longitudinal sulcus. We are going to take this section. What section is this? Is it transverse? Is it sagittal? Is it coronal?
It is coronal.
This is coronal, but we are only taking a piece of the, you see, we are taking a piece of the right hemisphere, which is this one, a piece of the left hemisphere, which is this one, and the median longitudinal sulcus, which is this one. This is coronal, but a small piece of the coronal. A piece of the right hemisphere, which is this. A piece of the left hemisphere, which is this. And a piece of the median longitudinal sulcus, which is this one. So let us look at this. So what layers cover the brain? Or specifically, what layers cover the cerebrum? You have the skin and the subcutaneous tissue and the hair, which is the scalp. Deep to the skin, we have the periosteum. The periosteum is a membrane which is covering bone. This is the periosteum. After the periosteum, we have the bone or the calvarium. This is the bone or the calvarium. After the bone, you have what you call dura mater. It's a tough membrane. After the bone, when you make an incision through your head, the blade is going to go through skin, through peritoneum, and then through the bone. And then after bone, you're going to see what we call the dura mater. And this is why you need to be very careful. The dura mater has two layers. The layer near to bone is known as the periosteal layer of dura mater, and the deep one is known as the meningeal layer of dura mater because it's near these membranes. These membranes are known as meninges. The outermost of the meninges is the dura mater, plus these other two. This is the arachnoid mater, and the one which is in contact with the brain is the pia mater. So below bone, you're going to have what we call the dura mater. This is one of the meninges, the membrane surrounding the brain, dura mater. And the dura mater has two layers. The periosteal layer of dura mater near to bone, and the meningeal layer of dura mater near to these other meninges. These are the two layers of the dura mater. Now, are you seeing that the meningeal layer of dura mater from the left and the meningeal layer of dura mater from the right, when they come to the median longitudinal sulcus, they join and then they enter into the median longitudinal sulcus. This is dura mater. In the median longitudinal sulcus, we have dura mater, a fold of dura mater. How is this fold formed? The meningeal layer of dura mater from the left and the meningeal layer of dura mater from the right, when they reach the median longitudinal sulcus, they fuse to form one fold of dura mater, which depresses into the median longitudinal sulcus. This fold of dura mater is what we call the falx cerebri. So when you look at this image, in the median longitudinal sulcus, there is always a fold of dura mater known as the falx cerebri, which is formed by the meningeal layers of the dura mater from the left and meningeal layer of dura mater from the right. When they reach the median longitudinal sulcus, they fuse to form that falx cerebri, which depresses into the median longitudinal sulcus. And whenever you're making scans of the brain, you're going to see in between the meninges the falx cerebri, because that structure is a fold of dura mater always in the midline between the two hemispheres. So skin, periosteum, bone, and the two layers of dura mater, that periosteal and the meningeal, and the two meningeal layers of dura mater from the right and the left, they fuse in the region of the median longitudinal sulcus to form the falx cerebri. Below the dura mater, we have this other membrane known as the arachnoid mater, both on the right and the left. This is the arachnoid mater. And deep to the arachnoid mater, lining the brain surface, is the pia mater. This pia mater is in contact with the brain surface, and you cannot separate it from the brain. It is known as the pia mater. So the pia mater is the deepest in contact with the brain. Then we have the arachnoid mater. We have the arachnoid mater there. We have the arachnoid mater, then above it we have the dura mater with its two layers, and then the calvarium or the bone, then the periosteum, and then the scalp. You can see that even the arachnoid mater will depress into the median longitudinal sulcus, and then the pia mater will also line the medial aspect of the brain. But the most profound structure is this one, which is the falx cerebri, which is the one depressing in the median longitudinal sulcus. When you're making an ultrasound scan, a CT scan, you will always see this falx cerebri in the median longitudinal sulcus. Now the spaces between these meninges are also important. The spaces between the meninges are important. This is pia mater, and this is arachnoid mater. This is pia mater, and this is arachnoid matter. The space between the pia mater and arachnoid matter, this is the space which contains even blood vessels. This is known as the subarachnoid space. Sub means below. So if it is below the arachnoid matter, we call it subarachnoid space. And the subarachnoid space is between the pia mater and arachnoid matter. It contains blood vessels and cerebrospinal fluid. This subarachnoid space contains blood vessels and cerebrospinal fluid. These structures you see are what we call arachnoid villi. They are structures which drain the CSF from the subarachnoid space and take it to the blood in the sinuses, which we shall look at in the future. So the space between the pia mater and arachnoid matter is the subarachnoid space. It contains cerebrospinal fluid. Embedded within the cerebrospinal fluid are blood vessels. And if you have injuries to the brain and blood accumulates in the subarachnoid space, we call that subarachnoid hemorrhage. And on CT, you can see hemorrhage or bleeding around the brain. You have to know, is it in the subarachnoid space or other spaces? If it is in the subarachnoid space, you're going to call that bleeding subarachnoid hemorrhage, because it is in the subarachnoid space, which is between the pia mater and arachnoid matter. Now, what about the space between the dura mater and arachnoid matter? The space between the dura mater and arachnoid matter, this space is known as the subdural space because it is below the dura mater. Subdural space. It is between the arachnoid matter and the dura mater, this meningeal layer. This is known as the subdural space. And if you have hemorrhage or bleeding or blood accumulation in the subdural space, we call that the subdural hemorrhage or subdural hematoma, depending on the circumstances. What about the space between the bone and the dura mater? Between the bone and the dura mater, this space between the bone and the dura mater is what we call the epidural space. There are blood vessels also there, the epidural space. If you have hemorrhage in the epidural space, we call that epidural hemorrhage or epidural hematoma. Epidural space between the bone and the dura mater. Subdural space between the dura mater and the arachnoid matter. Subarachnoid space between the arachnoid matter and the pia mater. We have talked about the layers surrounding the cerebrum, the layers of tissue covering the cerebrum, and the spaces in between the different meninges and their clinical relevance. We have talked about how the falx cerebri is formed, and they will tell you the clinical relevance of the falx cerebri, but here I have been concentrating on its anatomy. This is a preserved brain tissue, and you can see the white matter and the gray matter. This one is turning brown because of the preservation, but this is the cortex. In normal life, it is gray matter. This is the medulla, and it is white matter. And I've told you the logic behind white matter and gray matter. So we are seeing this lateral ventricle in sagittal. The lateral ventricle has an anterior part, a middle part, a posterior part, and an inferior part. In the transverse section, you're going to see a posterior portion of the lateral ventricle and an anterior portion of the lateral ventricle. In coronal, you're only going to pass through this portion of the lateral ventricle. So this anterior part is the anterior horn of the lateral ventricle. This is the body of the lateral ventricle. This is the posterior horn of the lateral ventricle. And here we have the inferior horn of the lateral ventricle. So the different sections show different parts of the lateral ventricles, but just know one thing, there are the cavities which are located in the two cerebral hemispheres. We looked at the lobes. We looked at the lobes of the brain, the frontal lobe. This is the frontal lobe. And this is the central sulcus. This is the parietal lobe. This is the occipital lobe. And the parieto-occipital sulcus is seen on the medial aspect. Then this is the temporal lobe, which is below the lateral sulcus. Now, the gyri of the frontal lobe are given names. The gyri of the frontal lobe are given names. This gyrus, which is adjacent to the central sulcus, is known as the precentral gyrus. It is known as the precentral gyrus. It is on the posterior aspect of the frontal lobe adjacent to the central sulcus. It's known as the precentral gyrus. The gyrus above, we are now on the gyri of the frontal lobe. This is what we call the superior frontal gyrus. Below it, we have the middle frontal gyrus. The boundary between the superior frontal gyrus and the middle frontal gyrus is this sulcus known as the superior frontal sulcus. Below the middle frontal gyrus, we have the inferior frontal gyrus, and the boundary between the middle frontal gyrus and the inferior frontal gyrus is this sulcus known as the inferior frontal sulcus. The inferior frontal gyrus is further divided in two portions. This is what we call the pars opacularis. This is what we call the pars triangularis, and this is what we call the pars orbitalis, because just below it you have our orbit. This is the pars orbitalis, pars triangularis because of its shape, and pars opacularis, looking like an opacula of the fish. So the frontal lobe, much as we saw it, and we said it's covered by the frontal bone and is separated from the parietal lobe by the central sulcus, it is made up of four gyri: the precentral gyrus, the superior frontal gyrus, the middle frontal gyrus, the inferior frontal gyrus, separated by these sulci. And the inferior frontal gyrus is further divided into these portions: the pars opacularis, the pars triangularis, and the pars orbitalis. When we are looking at the functions of the frontal lobe, these gyri are going to be of utmost importance. Those are the gyri of the frontal lobe. Are you seeing the image?
Yes,
sir.
What about the temporal lobe? The temporal lobe also has three gyri: superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus. Superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. And the sulci in between them, superior temporal sulcus and inferior temporal sulcus. The frontal and the temporal lobe, their gyri are further demarcated. These others, the occipital and parietal, they don't usually divide them into gyri. Now, the next time we meet, we are going to look at the functions of the different lobes. We have seen the lobes, we have seen the hemispheres. Now, we are going to look at the functions of the different lobes next Thursday. What is the function of the frontal lobe? What is the function of the temporal lobe? What is the function of the parietal lobe, what is the function of the occipital lobe, and what is the function of the insular lobe. And that is what we are going to look at next time when we meet. Today I have introduced the cerebrum, and you see that the cerebrum we are going to have 2 lectures because it's the largest part of the brain and it's very important. So you're going to go back this week, and I am serious about this.